Environmental and Cultural Factors of Eating Disorders by Nancy Bunnell. Cultural environment, media. Eating disorder diagnoses share a cognitive symptom of overvaluing one's body weight and shape. This is very much magnified by the role of media. U.S. adults are exposed to media for an average of 12 hours and 9 minutes per day. The role of media has reached far beyond TV, magazines, and advertisements. It isn't just everywhere now, it is in the palm of your hand. Social media hashtag groups, such as Bonespiration, Thinspiration, and Fitspiration, show pictures of extreme body conditions. Studies show that exposure to these groups is associated with an increase of body dissatisfaction and decreased self-esteem. Social media is portraying a world of perfection as the new normal. This includes phone editing applications, diet advertisement, food restriction, and clean eating. And that brings us to a newer type of eating disorder called orthorexia. Orthorexia is an obsession with proper or healthful eating. Those that suffer from orthorexia become so fixated on so-called healthy eating that they actually damage their own well-being. Like anorexia, orthorexia involves restriction of the amount and variety of foods eaten, making malnutrition likely. Cultural environment, family support. Many family members bear the burden of responsibility and blame for their loved one's eating disorder. Family members cannot fix the individual. Family members can only aid in the recovery process. One such treatment is the Maudsley approach. This is a family-based therapy, and it is effective treatment in adolescent eating disorder. Family-based therapy is an outpatient therapy designed to restore adolescents to health with the support of their parents. Patients are able to recover in their day-to-day environment with their support system around them, rather than sending them away to inpatient rehabilitation. Siblings also are given supportive roles in this treatment. Some things for family members to remember: be patient and non-judgmental, listen, remember that it is their responsibility to do the recovery work, and seek support and help for yourselves. Oftentimes, family members are weighed down by stress and caregiver burden. Cultural environment, role of peers. Adolescence is a stage of vulnerability. New focus on body image occurs, body changes related to puberty, and sudden weight changes. Situations may arise within peer groups, such as message pressure, which can result in weight-related teasing. Forms of interaction can occur that include sharing eating and weight concerns. Likability pressure might make one feel more likable when having a thin body or feeling acceptance from their peers. Peers have influence in recovery as well. A lot of times, those with eating disorders don't feel understood by their friends without eating disorders and become isolated from their current peer groups. Peer support is often found in groups with those experiencing eating disorders as well. Eating disorders have a very cyclical nature. It often begins with unease or dissatisfaction. This often results from mental health conditions or trauma. Next, there is a desire to exert control over those feelings, which often leads to using food to distract, control, or suppress. After this, negative feelings often reemerge, self-hatred is renewed, and the behavior repeats itself. Relapse in eating disorder rates are between 35 and 41%. This occurs mostly between 4 and 17 months post-treatment. Relapse prevention plans and monitoring should be implemented following the completion of one's recovery program. Cultural environment, legal, political system. Eating disorders are a public health issue because of their high prevalence, adverse health consequences, and no U.S. federal policies regarding eating disorders. In an interview by Levitt 2017, Bryn Austin, a member of the Strategic Training Initiative for the Prevention of Eating Disorders, states that they are asking the Centers for Disease Control to monitor eating disorders as a part of national disease surveillance efforts. This will help decrease misconceptions and provide increased data and information on eating disorders. Within the U.S., there has also been a push by advocacy organizations to introduce the Federal Response to Eliminate Eating Disorders Act in Congress. If this is passed, it could provide funding for research, education, and prevention activities and improve access to treatment of eating disorders by requiring treatment coverage to be covered within medical benefits. Some policy strategies to increase eating disorder prevention include 1. Improving school-based health curriculum on eating disorders. 2. Require training for educators and health providers. 3. Implement school-based anti-bullying policies. And 4. Improving standards of nutrition and well-being in schools. There are many potential barriers that affect eating disorder treatment options and healthcare. These include access, stigma, skills and knowledge, and pathways to care. Those living in remote areas may lack care options and resources, and may be limited to a number of providers trained in the detection, care, and treatment of eating disorders. There are many stigmas that come with the attitude and knowledge of the general public. These stigmas create shame, humiliation, and blame to those affected by eating disorders, which also decreases the chances for treatment seeking. The skills and knowledge of practitioners in the area of eating disorders is often limited. This causes a decrease in the chances of detection and appropriate treatment referrals. This also leads to unclear pathways. Oftentimes, those suffering or their families are unaware of how or when to access help. This can be helped by clarity in referrals and care pathways. In this population, biases occur in both those with eating disorders and in the general public. Those with eating disorders have implicit biases that include subconscious anti-fat thoughts, pro-thin thoughts, good versus bad food, distortion of self, and escape from self-awareness. Explicit biases that result from the implicit biases are refusal of food, frequent weights, self-harm, and selective attention. Implicit biases of the general public include those of gender, socioeconomic status, size, decreased detection by practitioners, and weight bias. Those result in weight-related bullying, blame, and judging. Health disparities, gender. Here are some statistics regarding gender in eating disorders. Subclinical eating disorder behaviors, which include binge eating, purging, laxative abuse, and fasting for weight loss, are nearly as common among males as they are among females. 58.6% of girls and 28.2% of boys are actively dieting. Eating disorders are more common among women than in men. The ratio is 3:1. 40 to 60% of elementary school girls, ages 6 through 12, are concerned about their weight or about becoming too fat. This concern endures through life. 68.4% of girls and 51% of boys exercise with the goal of losing weight or to avoid gaining weight. Transgender individuals experience eating disorders at rates significantly higher than cisgender individuals. Compared to other populations, gay men are more likely found to have body image disturbances and eating disorder behavior. Of the total male population who have eating disorders, 42% identify as gay. 15% of gay and bisexual men and 4.6% of heterosexual men had a full or subthreshold eating disorder at some point in their lives. Studies suggest that risk of mortality for males with disordered eating is higher than it is for females. This is in part because they are often diagnosed later, since many people assume males don't have eating disorders. Because of this, symptoms increase in severity, resulting in less effective treatment and care. While eating disorders are more common among women, men with eating disorders are more likely to experience concurrent depression and are less likely to access mental health services. Health disparities: religion, race, ethnicity, and socioeconomic status. The reality is that eating disorders affect millions of people from all walks of life. They affect men and women, people of all gender identities, all race and ethnicity groups, all income groups, and people across the country. Although eating disorders affect everyone, there are some factors that change as a result of race and ethnicity and socioeconomic status. People of color are less likely to receive help for their eating issues. Black teenagers are 50% more likely than white teenagers to engage in binging and purging. There is a higher prevalence of binge eating disorder in all minority groups. A 2014 study shows increased rates among all demographic sectors, but the rates grew faster in males, lower socioeconomic status, and older participants. Health disparities: geographical location. In the United States, 30 million people suffer from eating disorders. Worldwide, the number is 70 million. There are many factors for the rise of eating disorders around the world. These factors include urbanization, industrialization, media influence, westernization, and socio-cultural and gender role shifts. Still developing nations show lower rates of eating disorders. Eating disorders tend to be more prominent in wealthier countries and those that have become influenced by westernization. Westernization is described as the process of increased contact with Western views, perceptions, and media, and other Western ideas and culture norms. This westernization has changed culture and societal views in various regions of the globe. This can be a result of much of the technology advances. Eating disorders are not culture-bound or culture-specific, but they are culture-reactive. International scope. Those populations transitioning into modernization, urbanization, and other changes are at a high risk for developing problems with symptoms and treatment of eating disorders. Factors that affect this are lack of research and understanding. Studies mainly account for developed Western populations, and cross-cultural comparisons lack validity, information, and data. Increased awareness and resources for recovery can help those who are struggling with eating disorders around the globe. There are many online resources for treatment and information. Eating Disorder Hope is one of those. This website provides resources for treatment options around the world. No matter the country, people with eating disorders deserve the chance to reclaim their lives and their healthier selves.